Good afternoon and welcome to the City of Toronto's COVID-19 media briefing for Monday, March 15th, 2021. Joining us today is Toronto Mayor John Tory, Toronto Fire Chief and the General Manager of the Office of Emergency Management, Matthew Pegg, and Toronto's Medical Officer of Health, Dr. Eileen. Mayor Tory.
Well, good afternoon and thank you, Brad. Subject to questions of supply, our work to get as many people in the City of Toronto vaccinated as soon as we can continues, and within those constraints we continue to make progress. Our healthcare partners and Toronto Public Health have now administered a total of 263,532 COVID-19 vaccine doses in the City of Toronto. The effort to get shots in arms continues today, with 18 clinics open across the city. This is good news and represents solid progress. As you know, on Friday, we opened up registration for a further 133,000 vaccine appointments between March 17th and April 11 to be delivered at city-run immunization clinics. Residents 80 and over will be able to get their vaccine at the Metro Toronto Convention Centre, the Toronto Congress Centre, and the Scarborough Town Centre starting this Wednesday. To accommodate more appointments, 2 more city-run clinics will be opened on March 29th at the Malvern Community Recreation Centre in Scarborough and the Mitchell Field Community Centre in North York. And our 6th clinic at the Hangar in North York will open on April 5th. These 6 clinics will be open and operating 7 days a week from 11 a.m. to 8 p.m. with consideration to modifying those hours dependent upon take-up experience and supply. I know people are eager to get the vaccine. 11,178 people booked COVID-19 vaccination appointments in the first 3 days that the registration system was up and running. And of course, it continues to be up and running on a provincial basis today, as well as a call center. This is on top of the clinics our healthcare and hospital partners are conducting every single day. We know more vaccine is on the way, and we are urging the provincial and federal governments to send us as much vaccine as possible so that we can ramp up our efforts. This is a Team Toronto effort to get shots in arms and to stop this virus and to bring this pandemic to an end. I encourage all residents 80 and older to book an appointment either online or through the provincial call center. And I encourage everyone who has someone in their life who is 80 years or older to reach out to them, encourage them to book an appointment, and offer to help them if they need help either with the registration itself and or with attendance at the vaccination site. This vaccine will protect you and your loved ones, so please get vaccinated as soon as you are eligible. A reminder that the provincial registration system and call center are available at this time for residents 80 years of age and older. Similarly, the Toronto Mass Immunization Clinics will initially be reserved for 80-plus residents, so we respectfully request persons not in that age group not to try to register for or attend at those clinics at this time. In other good news, I am pleased to announce that the City will be expediting the opening of its community and allotment gardens this year so that gardeners can get a head start on the 2021 season. Although they typically open in early May, we know how important they are for residents in a number of respects at this time. These 81 community gardens and 12 allotment gardens across the city help to provide residents with a source of fresh food and a way to get outside and get fresh air and exercise, all of which are particularly important at this pandemic time. Community gardens will begin opening this week on a location-by-location basis until mid-May, and allotment gardens will open on March 17th. City staff will be reaching out to residents who are permit holders and to community groups to provide them with the information they need and with the health guidelines that must be followed. And this is a very important thing to keep in mind. There will be, on a continuing basis, health guidelines that must be followed in the use of these gardens. This has all been done under the advice and the direction of Toronto Public Health, and public health guidelines are in place to make sure that the gardens can stay safe and can stay open. I know this news will be most welcomed by our permit holders and community garden volunteers. Annually, more than 1,300 people use the city's allotment gardens to grow their own food and plants. Although water service will not be available until May to reduce the risk of damage to pipes caused by colder temperatures, gardeners are encouraged to get an early start on their planning and preparation work. These gardens have become a significant part of the lives of many of our residents. Each year, the city's community gardens and their volunteers support more than 25 community agencies and provide them with 2,000 to 5,000 pounds of fresh-grown Toronto produce. I would like to thank our very dedicated Parks, Forestry, and Recreation staff who have once again ensured that we're able to offer programs and services tailored to Toronto's public health conditions, and who have once again made sure that a program like this can be not just offered, but offered early. We have worked throughout the pandemic to keep Toronto's more than 1,500 parks, natural areas, and public spaces open and clean and safe, and we will continue to do that work. And as we move further into the spring and a further reopening, we will have more details about our parks and recreation services. We know people will want to get, more so than ever, safely outside this spring and summer, and we are working to make sure that our city's facilities are open as they can be for people to enjoy. In advance of the reports from Chief Pegg and Dr. Davila, may I just say, as I have a number of times in the past few days, that Dr. Davila, myself, Chief Pegg, and a number of members of our respective teams are engaged in virtually continuous discussions about the way forward for the City of Toronto in terms of public health restrictions, taking as full account as possible, as I've previously stated, of a wide range of factors, including business conditions, regional realities, the psychology of people, and most importantly of all, of course, public health considerations, as we try to fashion advice to the province and to ourselves, which can both protect health and move us forward safely. On that note, I will ask Chief Pegg if he would present his report for today.
Thank you, Mayor Tory. Good afternoon. On March 12th, the opportunity for Toronto residents 80 years of age and older to schedule their COVID-19 vaccination appointments via the online booking system opened. I'm very pleased to report that the interim online system performed extremely well over the weekend, with more than 11,000 Toronto seniors successfully booking their appointments online. This morning, the full provincial booking system, including both the online booking portal as well as the provincial call centre, went live across Ontario. With the provincial booking system coming online this morning, any Ontario resident born in 1941 or earlier is now able to book their COVID-19 vaccine appointments in the clinic and on the date and time of their choice, based on availability. As Mayor Tory advised, beginning on Wednesday, March 17, we will open city-operated mass immunization clinics in Toronto inside the Metro Toronto Convention Centre, Scarborough Town Centre, and the Toronto Congress Centre. On March 29, we will open our clinics inside the Malvern Community Recreation Centre and the Mitchell Field Community Centre. And on April 5, we will also open our clinic inside the hangar in Downsview Park, bringing the total number of city-operated COVID-19 mass immunization clinics to 6. At present, each of the city-operated mass immunization clinics will operate between 11 a.m. and 8 p.m. 7 days per week. When operating at full planned capacity, we will have the ability to administer up to approximately 235,000 COVID-19 vaccines each week in the city-operated mass immunization clinics alone. I strongly encourage everyone who was born in 1941 or earlier to make your appointment for vaccination now. If you have an Ontario Photo Health Card, you can book using the online registration system, which can be accessed via covid19.ontariohealth.ca. You will need to enter the following information as part of the booking process: the information found on your Ontario Photo Health Card, your birth date, your postal code, and an email address and/or your phone number. If you do not have an Ontario Photo Health Card, or if you require assistance in booking your appointment, please contact the Provincial Call Centre at 1-833-943-3900. The Provincial Call Centre is available from 8 a.m. through 8 p.m. 7 days per week. Please do not contact 311 nor Toronto Public Health for assistance in booking your COVID-19 vaccination appointment, as our staff are not able to access the not able to access the COVAX system on your behalf. I'm pleased to report that we now have completed the setup inside the North Toronto Memorial Community Centre location, and we have commenced setup operations inside the Carmine Stefano Community Centre. Following the completion of setup operations inside Carmine Stefano, we will commence with setting up the final city-operated clinic inside Cloverdale Mall. The North Toronto Community Centre, Carmine Stefano Community Centre, and Cloverdale Mall clinic locations are planned to open in April when vaccine availability permits. Once these clinics come online, appointments will be made available in the provincial online booking system and via the provincial call centre. In addition to the 9 city-operated clinics, more than 350 additional clinics are planned across the city, including clinics operated by hospitals, Ontario healthcare teams, community healthcare partners, primary care providers, and pharmacies. This is truly a Team Toronto effort, with all of the partners working together to get us all vaccinated as very soon as possible. I want to be clear that only those who were born in 1941 or earlier are able to book appointments in city-operated mass immunization clinics at this time. In order to avoid placing unnecessary loading on the booking system, we ask those who do not meet these eligibility criteria to avoid trying to access the online booking system until such time as you are eligible for vaccine. This will help to ensure an efficient and effective booking process for everyone as we move forward. If you choose not to book an appointment now, or you are unable to book your appointment for any reason, rest assured your opportunities to book your appointment will continue. Once you are eligible for vaccination under the Provincial Vaccine Priority Framework, you remain eligible continuously thereafter. Finally, please remember that vaccine is not available in city-operated immunization clinics without a confirmed appointment. Please help us maintain effective clinic loading by not coming to a clinic unless you have a confirmed appointment. I thank everyone in advance for their continued patience and cooperation. Please continue to monitor toronto.ca/COVID-19 for the most up-to-date information on immunizations in Toronto. Thank you. I now invite Dr. Davila to bring her update.
Thank you, Chief, and good afternoon. Today, I'm reporting 387 new cases of COVID-19. 282 people are in hospital and 49 people are in ICU. I'm sorry to have to report 2 additional deaths today. Sadly, this means that to date, we've lost a total of 2,721 loved ones from our community to COVID-19. It was only a couple of months ago, on January 7th of this year, that we passed 2,000 deaths in our city. On February 8th, I shared with you that we are in a transition from one pandemic to another, a transition to a new pandemic. This was after it was confirmed that the UK variant B.1.1.7 was in Toronto. Since that period in early February, 3,516 COVID-19 cases have screened positive for virus mutations. We should all be concerned by what we're seeing, both here in Toronto and when we look around the world. We have many reasons to be optimistic with the news of increased supply of vaccine. But I must be clear, the pandemic is not over. The COVID-19 variants are triggering third waves in Europe. Several countries are imposing new lockdowns or restrictions. Italy, where we all recall the shocking death toll at the beginning of the pandemic a year ago, locked down a majority of the country again today. Cases there were up 10% over the last week. All of Italy will be locked down until the Easter weekend to reduce the spread of the variants during a time when people are often together as congregants to worship or as family marking the holiday. Italy isn't alone. German officials have acknowledged a third wave. France has increased restrictions, with pressure rising around the idea of another lockdown. Poland, Hungary, and the Czech Republic are also seeing case counts that are beginning to match previous highs. All of this is attributed to the spread of COVID-19 variants. Here in Toronto, the variants raise the question about where we go from here. A decision will be made this week about where we best fit in the provincial COVID-19 response framework. I want to be clear. I only recommend restrictions when they are necessary to protect the greatest number of people from widespread risk of infection. I share everyone's desire to get back to normal. From a public health perspective, employment is one of the key determinants of physical and mental health. We often refer to the toll the pandemic is taking on mental health. My concern is how it affects everyone. Even at its mildest, the stress of living in this state of suspended animation is a burden. Overall, I'm also concerned by the numbers I see. Toronto's 7-day moving average for new COVID-19 cases is now sitting at 420, up from 354 on the 9th of March. The reproductive number for variants of concern is 1.2, and the reproductive number for overall cases is 1.1. The percentage of tests coming back positive for COVID-19 has increased slightly to 4.3. The most recent figures for Toronto that measure device time at home show a decline to 78.6%, meaning fewer people are staying close to home. The data also indicated more Torontonians were traveling to areas where restrictions were lower. We're on the move again, and although the risks remain, in some respects, they are higher than ever because of COVID-19 variants. I'm sharing this as a reminder that what we all do in our daily lives going forward is the key to preventing or at least limiting the spread of variants. And the single most important thing anybody can do to protect themselves and those around them is to get vaccinated as soon as they are eligible. While we have yet to see a sufficient and steady supply of vaccines for Toronto, our local supply is increasing, and if you are amongst those eligible for vaccination, I urge you to book your appointment. If you have a parent, relative, friend, or neighbor over 80 years of age, please check in on them. Please reach out to find out if they need help making arrangements for their vaccine or help to get to their appointment. I also ask that you help to remind people of the benefit of this protection from COVID-19. If you have questions about vaccines, I encourage you to speak with your family physician or visit our website or other credible information source. The pandemic is not over. It will be. We are nearing the finish line, but we're not there yet. I know everybody is tired of hearing we're almost there and frustrated with living as we're required to live in order to protect ourselves and protect the people around us. I share everyone's desire to get back to normal. Let's aim for a good summer. Let's finish strong by continuing to practice the steps for self-protection. This is a choice that only we can make for ourselves and for those around us, while vaccination efforts ramp up in our community. I'll now hand it over to Brad for the questions.
Thank you, Dr. Davila. A reminder to reporters to please unmute yourself before asking your question. We'll go first to Brian Passafium from the Toronto Sun. Brian?
Good afternoon, everybody. Hope everybody had a great weekend. First question, whoever wants to answer it. Last week, Mississauga Mayor Bonnie Crombie called on Dr. Lowe, the Peel medical officer, to move her city from gray into red. What's your reaction to that, and would you support the province moving Toronto into the red this week?
Well, I had a meeting, as I do every Monday, with Mayor Crombie and the other mayors from across the GTHA today, and we all talk about our respective health numbers, we talk about our business conditions, and a host of other things. And I think that, obviously Mayor Crombie speaks for herself and for her city. In our case, I indicated to her today, the following. We are engaged in virtually continuous discussions involving the Chief Medical Officer of Health, myself, and others, where we are trying to figure out what the best advice and circumstances are for the City of Toronto, taking into account health considerations, the psychology of the people, the regional realities, and business conditions in no particular order, except that health always has to come first. And so we will formulate from that the best advice that we can. This is not about picking a color out of a hat or picking it off, sort of a wheel in terms of the conditions that exist. It's about taking into account the actual health conditions, which Dr. Davila has outlined today, together with things like the business conditions and the psychology of people and what's going on in the rest of the region, and coming to the best possible answer we can that we believe is right. And that, in turn, is the subject of a recommendation made to the province who make the decision. So we'll do what's right, as we've tried to do throughout.
Okay, second question is, how hopeful are you that Toronto will be moved to the red zone in time for the anticipated restart of Cafe TO?
Again, I think that I would love for Toronto to be moved to the green zone as soon as possible. But, you don't live in a world where you get to make a wish and it comes true, except in Aladdin's lamp. And so in this, circumstance, we have to take account of the health realities, combined with the psychology of people, which is very important, and their habits and behavior, combined with the realities of this region and the state of the economy. And those are discussions we're having continuously, and we talk about them, all together, not as any one. And I hope we can move to less restrictive circumstances as soon as we can, and as soon as it's the wise thing to do, as soon as possible.
So if I can just add one little piece to that, it would be this, that, we take every recommendation that we make very seriously. These are not decisions or recommendations that are made lightly. And as I mentioned in my remarks, certainly when it comes to any recommendations around restrictions, those are only made when they're absolutely necessary to protect the greatest number of people from the risk of infection. We are absolutely looking at all the different circumstances, and clearly COVID-19 and risk of infection is chief amongst them. But it is a very carefully considered, a very, very conscious recommendation that is made, taking into account the many, many factors that contribute to health.
Thank you. We'll go next to Francine Copen from the Toronto Star. Francine, go ahead, please.
Oh, hi. My question is for both Mayor Tory and Dr. Davila. You've mentioned a couple of times the psychology of the people, and I'm wondering what your concern is on that front. Is concern about, the current psychological state of residents, is that giving you pause when you think about whether or not we should go into another lockdown? Because the numbers don't sound very good.
I'll give you the lawyer's answer first before we call on the doctor. When I make reference to the psychology of the people, I think I'm referring to two things. The first is looking at their actual behavior. there does come a point in time with different rules that they can lose some of their effectiveness if people are behaving quite differently than the rules are meant to induce. And I think that's just a reality that you have to take into account in making a determination as to what rules you believe should apply going forward. And then the second part is to do with people and their state of well-being overall, or lack thereof. And, Dr. Davila has been wonderful all throughout this in, I guess, doing what a professional in her field of endeavor would do, which is that you take account of the entire well-being of people, including their mental and psychological well-being, and it isn't just about COVID, it's about people's overall state of well-being. And so I always mention that in the two respects as one of the factors that you have to take into account. But I do that as a non-medical person, but just as a person who knows that people's behavior and their attitudes are something you have to think about when you're putting together restrictions or regulations that affect their lives.
So I think the mayor has summarized that quite nicely, and as I made reference to in my remarks, we certainly do have to consider the overall state of health of the population and what makes the most sense to improve and to protect overall health. I think the other component here, and perhaps the medical way of saying what the mayor was just saying, is that there is an adage or a maxim in medicine that you actually have to meet the patient where they're at. So I think we have to be reasonable around what is doable, what is possible in respect of the course of treatment that's being recommended for the patient, and cognizant as to whether that course of treatment or the recommendation is something that is actually implementable and doable on the part of the patient. So it's a combination of looking at all of these things that goes into the decision-making process.
My second question is, Dr. Davila, given your emphasis on the other countries that are locking down again and the rise in the reproductive number and other, concerning statistics, my takeaway from this is that we're looking at the possibility of another lockdown. Is that accurate?
Francine, at this point in time, it's a little early to say. I do think we have to constantly be looking at what's happening in other jurisdictions. That's part of informing what makes the most sense for us here. That's part of seeking out the best available evidence and understanding what actions we might want to take here in order to best protect and promote the health of our residents. But I think fundamentally what we know is that variants of concern are more transmissible. They are giving rise to more serious illness, and we need to pay attention to that. I think the good news part of the story is that we know what works. We know that public health measures and public health actions, the actions for self-protection, maintaining our distance, wearing our masks, these kinds of things actually do make a difference. So I think it's really important that we all remember that much of this is still very much in our hands. The more we're able to maintain that distance, the more we're able to wear our masks as much as possible, and the more we're able to get vaccines as our turn becomes available, the sooner we will get to the other side of this.
Thank you. We'll go next to Matt Bingley from Global News. Matt, go ahead, please.
Hi, good afternoon. Dr. Davila, the Ontario Hospital Association is saying that the data they are seeing is showing that we are in a third wave now. I'm just wondering, from the reproductive number that you're seeing in Toronto, as well as the rise in the 7-day average, would you say that Toronto is experiencing the start of a third wave as well?
Matt, to my mind, it's still early to say. Certainly, this is not the direction that we want to see the numbers go in. But as I just mentioned, I think we actually have a great deal of control here. We know what actually makes a difference if we would like to see those numbers turn around. We know that it comes down to those self-protection measures, to really maintaining our distance from others, particularly those with whom we don't live, and as well wearing our masks as much as possible, well-fitting masks, really keeping our distance, washing our hands. I know that these have been said time and time again, but as it turns out, even when we're dealing with variants of concern, with all the characteristics of transmissibility and more serious illness that they're associated with, we know that these measures work. So I just can't emphasize enough that we have a great deal of power in our own hands, all of us together. we know that we can actually control and limit the spread of variants, and I would urge everybody to continue that vigilance in those self-protection measures.
And I guess this might be a question for both you and Mayor Tory, but when you look at the mobility numbers, you're saying that you're seeing that data is showing that people are moving elsewhere. When you're talking about that regional aspect of where we move next in restrictions, is that what you're looking at to see, people are just going to go somewhere else to do their shopping when you're considering businesses, or would you like to see the province, adopt more of a wider approach to the GTA?
So, we know that in the Greater Toronto and Hamilton area, there's a great deal of mobility, between the various jurisdictions, some of which is related to work, and some of that is essential work. So I think we do need to keep an eye on that and recognize that that's certainly part of the picture here. But fundamentally, I think the advice has continued to be, even at the provincial level, to stay as close to home as much as possible. This is the reflection, or that is the manifestation, if you will, of really distancing to the greatest extent possible. So when it comes to what restrictions should be put in place, and whether we're talking about a regional approach, that's well within the provincial purview. That's for them to consider. But I would say that at the end of the day, if people do maintain their distance to the greatest extent possible, that does look like staying at home as much as possible, and when they have to go outside, only going out for those most essential of activities, wearing their mask as much as possible when they're doing that, particularly if they're interacting with others. So, we have much power within our own hands to shape the future and to help get us back to life more like it was before COVID-19 at the earliest possible moment.
If I can just add to that, Matt, we're so close. I mean, we're, the time when lots of people will have been vaccinated and where we are now, and if we can just bridge that gap while the chief ramps up the vaccinations and the province and the hospitals do, by having people just stay home and keep their distance from each other. And, it isn't so much people sure, it's thousands of people. We can see it from the phone data going literally to shopping malls that were open. Now the ones that are more open in Toronto. Yes, there's that. But every day you just look at the traffic cams on the Gardiner, the Parkway, the 400, people pouring into Toronto to come to work, and in many cases we need them to come to work, but I think the more of those people, as we've said all the way along, that could stay home, the more of the people that could stay home, except for, kind of a very, say, rare weekly shopping trip out and that kind of thing, we'll bridge that gap between today and when we get people, vaccinated in very high numbers, and the R number starts to go down and we see numbers that are going in the right direction. But in a way, all this color coding, it matters because it puts rules in place, but really people's decision just to sort of carry on with some of the good work they've been doing matters more than the color coding does.
Thank you. We'll go next to Natalie Johnson from CTV News. Natalie, go ahead.
Hi there. I understand that moving to a 24/7 model at the mass vaccination clinics is part of the plan for the city and is contingent on vaccine supply, but can you provide an update on when, based on your supply forecast, we might be moving to the 24/7 model?
Sure, Natalie. So like we've said from the start, we have plans in place to expand clinic operations when the time comes. And I would say that time is likely to be considered, and in fact we will consider at the point where we hit about the threshold of 500,000 doses a month. Somewhere between there and, of course, our planned capacity is almost 1 million doses a month. Once we hit the 500,000 dose per month mark, we would be at the point where it would make sense for us to consider expanding clinic operations into and potentially including 24-hour, but I don't see that happening before that point.
Are we talking the summer then, do you think, that we might hit that 500,000 point?
Yeah, very hard to predict because it's entirely dependent upon the supply and availability of vaccine to us. We are in a position right now where we could administer significantly more doses of vaccine than are being made available. So at the point when we have enough vaccine to get all 9 clinics open and to operate them at their capacity, we'll be ready to go with expanded clinic operations to meet the needs of our city.
Thank you. We'll go next to Nick Poivert from CBC News. Nick, go ahead.
Hi, thanks, Brad. And this could be for, I think, anyone at the table there. I'm just wondering if you can provide an updated sort of assurance, if there is one, to people who are either undocumented or migrant workers who are living in the city when they become eligible during phase 2. Are there any assurances to people in that situation that they're not going to have their sort of immigration status exposed or passed on to anyone in any way?
So Nick, why don't I take that question? You know, our understanding is that there are ways for which those who have undocumented status here to be able to get access to vaccine. And it's my understanding as well that there should not be any risk to their immigration status as a result of having received vaccine. We want people to get vaccine. It is part of protecting themselves and protecting our community as best as possible. And frankly, their immigration status is not relevant to whether that protection is provided to that individual and to those around them.
Okay, and I see as well that at the moment there is a requirement for some type of government ID in order to book one of the appointments. I see that the city says that there's some work being done to maybe change that. You know, we're now maybe just a couple of weeks away from phase 2 and essential workers being eligible. How soon can we expect a change on that front? So, you know, let's be clear. This is a medical intervention, right? This is still, it's a vaccine, and it is a treatment or a preventive treatment. So it is important that there is a record maintained. And it's clear, it's important that it's clear, particularly with a 2-dose vaccine, that the 2 doses are given to the right person, that they're given at the right interval, and that if there is any sort of follow-up that's required, it's important to know what vaccine was given when. So I think that's first and foremost, that there needs to be a clear medical record for a medical intervention. Now, we don't want that to, you know, disrupt or interfere with any other issues that there might be. But this is a provincial system, and it's our understanding that they are working through with each of the jurisdictions around the province how best to make sure that we're able to identify individuals properly without compromising them in any way, shape, or form, but in a manner that allows them to receive this preventive medical treatment safely and appropriately.
Chief?
Yeah, if I may just add to that, just to clarify and maybe a little bit of an exclamation point, anyone who has the photo health card and has that documentation can book online. Anyone who is in a position today where they do not have a photo health card, and that would include those folks that either don't have one at all or those folks that have one of the old red and white cards, can book. That is a function and a service that is provided through the provincial call center. That's available to everyone at 1-833-943-3900. So anyone that meets the criteria at this point in time, born in 1941 or earlier, who do not have the ID requirements to book online, do it through the provincial call center, and that team is prepared, ready, and able to help.
Okay, thank you. We'll go next to John Chidley-Hill from the Canadian Press. John?
Good afternoon, everyone. My question is for both Dr. Davila and Chief Pegg. The provincial booking portal came online today. I was just curious if either of you were aware of any issues with it working, or if there have been any hiccups in combining the Toronto pre-registration system with the provincial system.
Start, so I can say that we brought, as you know, that the province of Ontario brought the City of Toronto onto the online booking portal late last week, and I'm very pleased. It worked seamlessly over the course of the weekend to the point where more than 11,000 people successfully booked through that online portal. It, of course, was taken down last night and overnight, and then the full provincial system came on this morning. And what I can say is that appointments are continuing to be booked on a very steady basis. We know that more than 2,000 additional appointments have been booked in city-operated clinics this morning, and that is ongoing. So at this point in time, to the best of my knowledge, it continues to work. We did hear, as I'm sure many have, did hear some concerns being raised. I know that the provincial team is is absolutely on that. Our team is monitoring as well. But at this point in time, the experience thus far has been great.
Follow-up, John?
Yeah, sorry, Chief Pegg, I have a follow-up for you. I see you just put your mask back on.
Okay.
Sorry about that. You mentioned that having 500,000 doses available was one threshold that the city is looking for in terms of being able to ramp up vaccinations. I'm curious, are there any other milestones or benchmarks you're looking for in terms of supply to open up more clinics or opening up vaccination availability to other age groups or population groups?
Well, a couple of those are actually two different things. So with respect to our ability to expand clinic operations and open the remaining city-operated clinics, that is entirely based upon vaccine supply. So we need to have the supply and the assurance of that continuous supply in order for us to open and to continue in a sustained and consistent manner. So that's a supply issue. I'll actually pass to Dr. Davila, but with the decision with respect to when additional priority groups are brought on board and when additional age eligibility groups are brought on board is a decision of the province of Ontario in accordance with the provincial vaccine priority framework. Dr. Davila?
Yeah, I don't know that I can say it any better than that. As the chief indicated, there is a provincial prioritization framework. That's the framework under which all of us are operating, whether we're talking about local public health units or other vaccination partners within our jurisdictions. So we're following that framework, and as the province moves us all through that framework, that's how new groups become eligible for vaccination.
All right, thank you. We'll go next to Dave Ryder from the Toronto Star. Dave?
Hi, everybody. Dr. Davila, looking at the detailed Excel information on the city dashboard, it shows a pretty strong decrease in new daily infections, the 7-day average, until about March 2nd. And then it starts what is now like a pretty steep climb upwards. Can you tell me why would it turn around on March 2nd? Do you think that's kids going back to school a little earlier, or is it variants, or is it a combination of both?
You know, Dave, I'm not sure that that anyone can say definitively at this point in time. You know, here we are on March the 15th. We're only looking back a couple of weeks, and I think it does take a little bit more time and a little deeper an investigation to fully understand what happens within the context of a pandemic. But fundamentally, given what we know about how this disease spreads from one person to the next, what we're talking about is increased interaction between people, and interaction of the sort that's close enough that they are able to get into contact with the respiratory secretions of one person to the next. So, you know, it may have occurred through, you know, all the places where people congregate. Schools would be one of them. But there are many other places within our community where that does happen. And sometimes it's you know, solely at a personal level, you know, social interactions. So this is fundamentally what it comes down to. Interactions between people in close contact and oftentimes without the use of appropriate protection, like a mask, so as to prevent transmission from one person to the next. That's why when we're talking about, you know, where we go from here and, you know, how best we get ourselves to the other side of this pandemic, you hear us talk time and time again about vigilance around those self-protection measures of keeping our distance, staying at home as much as possible being the ultimate in distance, and then wearing our masks as well in order to prevent transmission and to protect ourselves from transmission. These are the things that actually will prevent that from happening, or at least limit it to the greatest extent possible and allow for our vaccines to have the greatest effect possible.
Thank you. And then the follow-up, I guess, to you or Mayor Tory, if he wants to add in, is when you talk about where we go from here, can you tell us what day you expect to make the recommendation? And is this a regular, is it like every 2 weeks, or how often are we going to look at whether we stay in gray whether we move to red, I guess, given all what's going on with the variants and everything else?
So ultimately, that decision really rests with our provincial counterparts. But certainly here, we're having regular conversations daily, as you heard from the mayor, around what we're seeing on the ground and how that needs to be considered in our deliberations and in what recommendations come forward. And over the course of this week, I expect that we'll be having regular conversations and increasingly regular conversations with our provincial counterparts around how best to proceed, recognizing that we all have this shared goal. We want to protect and promote the health of the people of this city to the greatest extent possible. And we're talking about that overall perspective on health that you've heard us speak about earlier this afternoon. Yes, we're looking at COVID-19 risk, but we're also looking at overall physical and mental health of the population and what makes the most sense at this point in time, at this phase of the pandemic, and at this phase of the vaccination campaign rollout.
I'll simply add to that from the non-medical perspective that I'm quite straightforward in saying these discussions happen continuously. As Dr. Davila would tell you, we talk about this virtually every day. And we talk as well, not just to each other, but to stakeholders. I talk to the Premier and the Minister, and our offices speak with each other. I know Dr. Davila talks with her health counterparts. So we're talking, and I talk to the other mayors, for example, even as recently as today. So it's a continuous discussion. The province generally wants to hear from us, every so often on this in terms of our advice, because they have their own series of meetings that go on. And as you know, each week they make some changes to somebody's designation or to some of the rules like they did this past Friday. And I just think we want to be in a position where when they ask and when we decide it's time, that we have advice to offer them that's thoughtful, that is consultative, and that represents what we think is in the best interests of Toronto, knowing that not only do we want to keep things safe, like Dr. Davila said, but we want to absolutely, positively avoid, as much as we possibly can, a chance of a further extensive lockdown that we've just started to come out of.
Thank you. We'll go next to Jessica Ng from CBC News. Jessica?
Good afternoon. Just on that same note, I mean, if the Ontario Hospital Association is saying that we, are in a third wave, and I know, Dr. Davila, you said earlier that, it's too early to say, but if we are on the precipice of a third wave, how soon could these businesses, many of which that are just starting to reopen, how soon could they potentially, again, see lockdown measures take them into further closure and further debt at this point?
Jessica, I would say that at this point in time, it's our sincere hope that we work together, all of us, to do everything we can to avoid that. And what we do know from the experiences around the world is that distance works. The more we are able to keep our distance from each other and, to limit interactions with others only to those things that are most essential. And when we have to do that, the more we are able to wear our masks and wash our hands and practice those steps for self-protection, the more successful we will be at preventing the spread of these variants of COVID-19 and at the very least limiting their spread in our community so we can avoid that. I mean, there's no question. You've heard us say this many times. None of us wants to, continue to live in a state of, as I described it, suspended animation. This has a significant burden on all of us. And we know we're so close. You've heard the mayor talk about this just this afternoon. And we know what works. So we're really asking people as much as possible, and we know this is hard. We know this is a tough ask. Limit your interactions to the greatest extent possible. Practice the measures for self-protection. Get your vaccine when your turn becomes available. And we will soon see ourselves, on the other side of this without having to go to those kinds of restrictions or to lockdown type measures in the future, as the mayor just said. We are really, really trying to do what's best, to apply the knowledge we've gained over the course of the last year, to learn from the experiences of other jurisdictions, to allow us to enjoy the best possible health. And we do mean health in all aspects here in the city.
Thank you. And just a secondary question. Since Toronto moved to the gray lockdown stage, have bylaw officers been vigilantly ticketing businesses that have gone over that 25% threshold? Have there been measures put in place to increase monitoring, or what has the city seen in that respect?
Chief, and then maybe Carlton's also on the line, Chief.
Sure, I'll start and certainly hand off to Carlton. Our enforcement activity and our enforcement strategy, if you will, has not changed. Our coordinated enforcement team is continuing to be in place as it has been in the past, working both proactively as well as in response to complaints. So as always, when complaints or concerns are raised, they are assessed, they are triaged and responded to on a priority basis on the basis of determination of risk, as well as our proactive activities on a daily basis. So Carlton may wish to add.
On that?
I think nothing further to add. Well said, Chief.
Okay, thank you for that, Carlton and Jessica. And finally, final question is to Adrian Gobriel from City News. Adrian, go ahead, please.
Hi, good afternoon. As you both all mentioned this morning, I think a question probably for Dr. Davila. Friday through Sunday, the city saw just over 11,000 vaccination appointments booked by those 80 and over in the city of Toronto. By comparison, a couple weeks ago, York Region launched their online portal, and they saw 20,000 80 and over seniors in that region book an appointment within a matter of hours. So my question is, are you concerned that about 10.5% of those who still need a vaccine in Toronto who are 80 and over have booked an appointment? Is there a reason why enrollment numbers seem low in Toronto over a matter of days compared to what our neighbors to the north saw in a matter of hours?
So I think that understanding the flow of vaccination appointments and bookings as we've seen them will require a lot of digging into the system. And I would also suggest this. We know that our mass immunization clinics, us, the City of Toronto, Toronto Public Health, we are but one vaccination partner. We have several other vaccination partners who are participating, and we're grateful for that, in vaccination efforts, including providing vaccines to those who are in that 80-plus category. So what we're looking at is just, and that 10,000 that we reported, or 11,000 that was reported over the weekend, only looks at those that booked into our mass immunization clinics and does not account for those who have booked into other vaccination partners' clinics. So I don't think that that gives us a full perspective as to what's happening here in the 80-plus population. And clearly, across the entire province, we're all working very hard to ensure that all those who would like to receive a vaccine and are eligible to receive a vaccine get that vaccine as efficiently and as quickly as possible.
Could I just add one more thing, which is, I believe I'm correct in saying that the 11,000 that have booked appointments is in addition to upwards of 40,000 people in the 80-plus age group who've already received a vaccine in the City of Toronto. And that was after we had a much larger number of people in the frontline worker stage 1 category to look after. Including a lot of people from 905 who ended up having their vaccination here, but there are people who were frontline responders. We have far more of those. Half the doctors in all of Ontario reside in the City of Toronto or work here and receive their vaccination here. So these are things challenges we had to meet, but we've nonetheless vaccinated tens of thousands of people over 80 already, and now have these 11,000 appointments plus, because it goes on today. So I think that we're ramping it up. It's a team effort, and we're working with the hospitals, and we're not, we're just in a competition, I guess, right across the province, all shoulder to shoulder to get this done as soon as we possibly can for everybody, including the over 80s and everybody else.
Just one follow-up. I know you mentioned the hospital partners that are working. Is the city able to track? Do you have any idea how many additional appointments have been booked at the pop-up clinics and at the hospital level, Dr. Davila? And I guess, if we don't see the percentage of 80 and over go up of people booking appointments by, mid to end of week, is there then real cause for concern?
So a couple of things. When it comes to that, or the numbers that are booked into hospital clinics, I don't have access to that in real time, but we do have a table, a health sector vaccine leadership table that is meeting regularly here in the city to discuss those issues and to share information around our vaccination efforts. And of course, as people get entered into that provincial COVAX system, as they receive their vaccines, then it becomes easier to report and understand, on a total basis, who in Toronto has been vaccinated and at which clinics. So I think the information will come in over time. When it comes to looking at what we're seeing in terms of, how much coverage do we have of the various populations as their eligibility comes up, we're constantly monitoring that. That's part of our job, to ensure that, we understand who's taking up the vaccine, who might not be taking it up at optimal levels, so that we can then determine what are the appropriate courses of action to ensure that, whether it's a question of access or a question of information, that we're addressing those questions and making sure that we're getting vaccine out and available to people who are interested in pursuing that vaccine as quickly as possible.
Thank you. And Adrian, I'll just add, we do issue every morning at 6 a.m. a news release with updates in terms of vaccine numbers, and I'm happy to share that with you when we conclude here. Thank you all. That does conclude today's briefing. Our next scheduled briefing is on Wednesday at 2 p.m. Stay well.